Welcome to Total Joint Replacement class. Thank you for joining me as you prepare for your total joint replacement. My name is April Matthews. I am the Orthopedic Spine Nurse Navigator, and I will be your host today as we journey total joint replacement together. In addition to our presentation today, you may access the physical therapy videos online at www.universityhealth.org to view exercises you will be performing following surgery. Click on our Services and Specialties link and then choose our Ortho Spine Services link. Once you have arrived at the Ortho Spine Service page, click on After Your Orthopedic Surgery link, which will take you to the web page where the physical therapy videos are located. For those of you who are having traditional total hip replacement, you may watch the occupational therapy video to gain insight on how to get through the recovery process easier following traditional total hip replacement. For those of you having total shoulder replacement, you will watch the occupational therapist teaching you specific information and tips on how to get through the recovery process, as well as specific exercises for you to perform after total shoulder replacement. Our journey. This class was designed to give patients and their caregivers information in advance of surgery to help decrease anxiety and fear before the day of surgery arrives. The goal of this class is to educate and prepare patients and caregivers so they know what to expect in the days ahead. Why joint replacement? Patients decide to have their joint replaced for pain relief, to improve motion and mobility, to increase the strength of muscles around the joint, as well as to provide for easier movement of the joint and to regain your independence. How do you know if it is time to proceed with surgery? If you have trouble getting out of a chair, going up and down stairs, getting off and on the toilet, unable to sleep at night due to the pain, if your medication is no longer working to relieve pain, and bottom line, if your pain and immobility keep you from performing everyday tasks and from enjoying life, then yes, it's time to pursue total joint replacement. The preoperative phase of the journey. During the preoperative phase of the journey, you will be meeting with the orthopedic surgeon to discuss and plan for surgery. You will also attend the total joint replacement preoperative class. Now is also the time to begin planning who will care for you following your hospitalization. No one needs to go home alone. Think now of who may be able to care for you in the home setting, or you may need inpatient rehab. It is never too early to start planning for your care following hospitalization. Let's learn together about total joint replacement. An anatomy lesson. Let's turn our attention to the anatomy of the knee, hip, and shoulder. Your physician will speak with you in the office and inform you on the specifics of your joint needing replaced. This is a very brief anatomy lesson. The knee is the largest joint in the body. It is a hinged joint made up of the end of the femur coming together with the tibia, which is your shin bone. The fibula runs next to the tibia, and your patella, otherwise known as the kneecap. Articular cartilage covers the ends of the bones to allow for a smooth surface for the bones to glide in harmony with one another. Due to arthritis or due to an injury such as a trauma, the articular cartilage wears away and causes the pain due to the bones rubbing against each other and can cause instability as well as feeling as if your knee will not hold you up at times. The hip joint is a ball and socket joint, again made of the pelvis coming together with the head of the femur bone. The top of the femur is shaped like a ball and it fits into the pelvic socket. Covering the ends of the femur and the inside of the pelvic socket, you have articular cartilage, allowing for the smooth gliding of the ball of the femur to move in harmony inside the pelvic socket. However, due to arthritis, trauma, or possibly a childhood hip disease process or disorder, your cartilage has worn away, causing pain and immobility. The shoulder is also a ball and socket joint. The shoulder is made up of the humerus, scapula, and clavicle coming together. The humerus fits inside the glenoid socket. The articular cartilage covers the inside of the glenoid socket and on the outside of the humerus, which is shaped like a ball. The cartilage wears away due to arthritis, trauma to the shoulder, or repetitive motion causing pain and inability to use the shoulder as you once could for everyday tasks. The replacement program booklet is given out in the pre-op class, so you may read and review all of the information concerning your upcoming joint replacement. Have your caregiver read the booklet as well. You will note a page of exercises and a patient family care path which reviews your schedule of each day's activities. We will now discuss who will be involved in your care during hospitalization. The orthopedic surgeon will perform the surgery and be in charge of your plan of care. The anesthesiologist will administer the medication to put you to sleep during the surgery and then reverse the effects of medication to allow you to slowly awake. They may call you the evening prior to surgery to obtain a medical history, obtain a list of medications you take on a daily basis. They will also remind you to have nothing to eat or drink after 12 midnight. The nursing team. You will be on the 10th floor, known as 10 North South, in a private room after your surgery and recovery. The nurses will carry out the plan of care as ordered by your physician. The physical therapist. They will assist you in making a recovery plan following joint replacement. They will teach you the necessary exercises you will need to perform to regain strength in your operative site and to ensure you are using a walker correctly. Occupational therapist. They will work with traditional total hip patients to teach them tips to get through the recovery process smoother. They also work with the total shoulder replacement patients, teaching exercises and tips on getting through the recovery process by using adaptive equipment. Case manager. This is a nurse who will ensure you will have a safe discharge plan. The dietitian. The dietitian will see diabetic patients and anyone with special dietary needs. The pharmacist. The pharmacist will ensure medication safety during your hospitalization. The navigator is an educator and also coordinates services under the direction of your orthopedic surgeon. The manufacturer's technical representative is in the operating room with your prosthesis that has been ordered especially for you. They leave after the surgical implantation. They do not perform any surgery. Should you have questions concerning the maker of the prosthesis or what material the prosthesis is made of, please ask your orthopedic surgeon. Now, let's talk about what you need to do before having surgery. You will see your orthopedic surgeon in pre-op, and he may direct you to see your primary physician or your cardiologist if you're under the care of a heart specialist. You may also be asked to see the dentist to obtain a clearance regarding dental health. Your physician may direct you to donate blood. You will have a preoperative appointment at University Hospital following your preoperative appointment with your orthopedic surgeon. The surgeon will fax orders to our pre-admission testing. You may have lab work drawn, possibly a chest x-ray, EKG, and a nasal swab for MRSA or MSSA. Please bring all your medication in the original bottles to your pre-op appointment at the hospital for the nurse to document which medications you take on a daily basis. This includes any over-the-counter medications too. In preparation for your return home, you will need to do a quick safety assessment of your home. You do not want to wait till you get home in order to complete this task. Make sure you have clear walkways in the home. Remove throw rugs and put away in a closet. Make sure you have adequate lighting in hallways and rooms of your home. Keep frequently used items in the kitchen and bathroom at waist or counter level so you may easily reach out for them. Non-skid bath mat in the bathroom. Also, now is the time to plan ahead in regards to how you will spend your time during your recovery. Go ahead now and purchase or check out books, crossword puzzles, etc. Your schedule will change due to you will need added rest to recover from surgery. Also, decide now who will be able to drive you to your appointments, as you will not be able to drive until your physician gives you clearance to drive. Cook and freeze meals ahead. Pay bills ahead of time. Coordinate with family members or friends to run errands. Also, ensure you make arrangements for someone to care for your pets during this time. When you are in the hospital following surgery and recovery, you will be in a private room. There will be a wipe-off board in each room where the nurse or patient care assistant will write their names, each shift, the current date, and any important information you will need to know. Our journey. Pre-op at the Outpatient Registration Center. Here is a picture of where you will be coming to pre-op at the hospital. You may park just outside the front entrance. As you enter, you may turn right and get on the elevator to come up to the second floor to register for surgery and then meet with your preoperative nurse. Here is the registration area. After the registration is complete, you will go to a pre-op room. This is where the nurse will meet with you to obtain a health history, and you will be given information about how to get ready for surgery. Vital signs will be taken, lab work will be drawn as ordered by your orthopedic surgeon. You may have a chest x-ray and EKG. Your nasal passages will be swabbed, looking for MRSA or MSSA. Please bring all medications in their original containers for the nurse to enter information in the computer. Here is a picture of the nasal swab. Your swab stick will be sent to the lab for testing. If you are positive, meaning you carry the bacteria in your nose, then a prescription for mupirocin will be called in for you to the pharmacy that you designate. You will give your pharmacy information to the pre-op nurse. People can pick up this bacteria from anywhere in the community, and it just harbors in your nose. However, if you are positive, you will be treated for the bacteria prior to surgery. The pre-op nurse will give you the Betasept surgical wash. You will be instructed to take a shower in the solution the evening before surgery. Do not apply to your hair, face, nor private parts. Sleep on clean linens and in clean pajamas or gown. The following morning, upon awakening, take a second shower in the surgical wash, following the same routine of not applying to your face, hair, or private parts. Do not apply any additional hair products such as conditioner, hair gels, mousse, hairspray. No makeup, lotions, perfumes, nail polish, jewelry, hairpins, nor deodorant. Do not shave or remove hair from any part of your body. Remember, no alcohol or smoking 24 hours prior to your surgery. You will come to Surgery Care Center, located on the second floor of the hospital on the day of surgery. You will have a private room and bathroom. Many activities will occur when you are in Surgery Care Center. The nurse or patient care assistant will have you change into the gown. ID bands will be placed, vital signs taken. You may have labs drawn. Your IV will be started. Your pain cocktail will be administered. You will wear footy socks, as these have rubber grippers to prevent falls and injury. The nurse and other caregivers will ask, "What procedures are you having done today?" This is a safety measure to ensure correct surgery site. The incentive spirometer will be given to you, and the nurse will review how to use properly following admission to your private room on 10 North South. You will use the spirometer 10 times per hour when awake, all during your hospitalization, to ensure adequate airflow throughout your chest. After surgery, one tends to breathe shallow due to anesthesia and narcotic pain meds. Also, cough and deep breathe from time to time to ensure adequate airflow throughout your chest. The orthopedic surgeon will come and see you and perform site verification. The anesthesiologist will visit, and just before going to the OR, will give you a sedative in your IV to relax and calm you. The circulator nurse will visit and will be the nurse by your side in surgery. She or he will call your family midway during the surgery, generally once the prosthesis has been implanted, and give an update. The surgeon will call after surgery completed. Your family may be given a room assignment in which they may wait for you during surgery. If a room number is not available, then they will wait in the waiting room and have a tracking number to track your progress from surgery to recovery. Please remember, another important exercise to perform to promote good circulation in the lower legs and feet is an ankle pump. You will flex your feet at your ankles back and forth 40 times per hour when awake, following surgery and recovery. When you perform this exercise, the calf muscle squeezes down on the veins and arteries, causing blood movement in the lower legs and feet. Your pain will be managed the entire hospitalization. Before you are administered any pain medication, you will rate your pain on a scale of 0 to 10, with 0 being no pain, 5 being moderate pain, and 10 being the most excruciating pain you could imagine. The nurse will have you rate your pain before receiving pain medication, and then will later return to have you re-rate your pain to ensure medication is working to relieve your pain. Patients rave about the pain management protocol. In Surgery Care Center, you will receive 4 medications for pain along with an acid reducer. In surgery, your joint will be bathed with pain medication. Your pain will be managed on the nursing unit as you will receive pain medication on a scheduled dosing time. You may ask for additional medication for pain relief should you be experiencing breakthrough pain. Don't be afraid to ask for pain medicine. Our surgical phase. A knee replacement surgery can last up to 1.5 hours. A hip replacement can last from 1.5 hours to 2 hours. Shoulder replacement lasts from 1.5 hours to 2 hours in length. After surgery, you will go to recovery. There you will slowly awake from the anesthetic medication you have received. You will be on your bed as you will transfer from the OR table to your bed. The nurse will take your vital signs frequently. Pain assessments will be performed. Neurological assessments such as telling the nurse your name, date of birth, which lets the nurse know you're waking up appropriately. You will be in recovery for at least 1 hour at a minimum. You will be transferred to the 9th floor Orthopedic Spine Center on your bed. Your recovery room nurse will call a report to the nurse receiving you on 10 North South to inform them of how your surgery and recovery went and share other important information with them to continue your care. Arrival to the nursing unit. Many activities will occur after you arrive on the nursing unit. Vital signs will be taken frequently. Sips of clear liquids to a clear liquid tray will arrive. You will wear oxygen overnight and a pulse oximeter on your finger to monitor your oxygen level in your bloodstream. You will have an ice gel packed to your joint. You will have an IV with IV fluids connected to an IV pump. Sequential compression devices will be on your feet or legs, depending on what surgery you had. Knee replacements wear the foot wraps, hip patients wear the leg wraps, and the shoulder patients wear foot or leg wraps as designated by the physician. Physical therapy will visit the knee and hip replacement patient. If you are having surgery after 2:00 p.m., you may see the physical therapist the day after surgery, depending on what time you arrive on the nursing unit. You may have a continuous passive motion machine on your leg, bending and extending the knee as ordered by the surgeon. You may possibly have a hemovac drain, in which is a collection device to collect drainage. This will be emptied every so many hours as ordered by the physician. Continued frequent vital signs checks during the evening and night. For those of you who had early surgeries, you may have a regular diet for your evening meal. The day after surgery will be quite busy. Labs will be drawn in the very early morning hours, so when the surgeon rounds, he will have the lab results. The orthopedic surgeon will visit. A regular breakfast tray will be delivered. Vital signs will be checked. Medications will be administered by the nurse as ordered by the physician. Your oxygen and pulse oximeter should be discontinued as ordered by the physician. Your hemovac drain may be removed by your physician or may be removed by the nurse as ordered by your physician. Your IV fluids may be stopped, but your IV site left in, as it will be removed just before you dismiss from the hospital. Physical therapy will visit in the morning and again in the afternoon. They will also let you sit in the chair for a while. Use the spirometer 10 times per hour when awake. Perform 40 ankle pumps per hour when awake. Some patients may go home the afternoon of their post-operative day 1. Post-operative day 2. This is the day most patients dismiss to home. Morning labs are drawn. The surgeon rounds and decides if today is the day you're dismissed to home. The surgeon discusses the discharge plans and instructions with you. Your vital signs will be taken, regular dietary meals served. Your nurse will administer morning medications. Physical therapy may return to work with you if you did not meet your physical therapy goals the day after surgery. The nurse will review the after-visit summary, which contains all of your appointments, new medications, when to resume home medications, and how to care for your new hip, knee, or shoulder. A total joint replacement card will be given to you to document your surgery and to remind your physician or dentist you will need antibiotics prior to dental appointments or any invasive procedure. Hospital Day 3. Most patients are in the hospital on post-operative Day 3 if they have Medicare and are going to a skilled nursing facility. Orders will be placed in a packet and sent to the facility with the patient. Patients' families will drive them to the facility. Very rarely does a patient travel via non-emergent ambulance due to strict guidelines. Physical therapy will teach you how to go up and down stairs safely, as well as teach you how to perform the exercises correctly to strengthen your new knee or hip and to get the best range of motion possible. Remember, you are promoting circulation when you are up with physical therapy and taking good deep breaths. Physical therapy is your key to a successful knee and hip replacement. Occupational therapy. The occupational therapist will teach the total hip replacement patients how to use adaptive equipment to make the recovery process easier. They will see you on post-op day 1. Occupational therapy will see the total shoulder replacement patients on the same day of surgery if admitted before 3 p.m. However, they will see all patients the day after surgery for extensive teaching on how to perform exercises and to get dressed and undressed, as well as how to don and doff the shoulder sling. Begin now planning for your discharge. No one should go home alone. Please call me as soon as possible so I may assist you in finding a rehab to go to if needed. Discharge plans following hospitalization include, for those having hip replacement, home with home health physical therapy. For the patients having direct anterior approach total hip replacement, this will be based on the physician preference. You may have home health physical therapy, or you may go to an outpatient physical therapy center. For those patients having total knee replacement surgery, the goal is to attend outpatient physical therapy. For those patients having total shoulder replacement, the goal is for each patient to attend outpatient physical therapy. For patients who need inpatient care, there are 2 types of rehab. Acute rehab, such as Health South Walton Rehab, or Doctor's Hospital Rehab. They have 3 hours of therapy per day. You must meet medical necessity to go to rehab and must have insurance approval. Skilled Nursing Rehab. Therapy is shorter in duration, but inpatients may stay a little longer than in an acute rehab setting. Medicare Part A pays for 20 days at 100% of the cost. Days 21 through day 100, Medicare Part A pays for 80% and leaves a 20% copay. Patients with private insurance or managed Medicare plans will have to get approval from their insurance company prior to acceptance. This approval is given following surgery and occurs during the hospital stay, as it is based on how you're doing following surgery and also based on your performance with physical therapy. Should you need equipment such as a walker or a bedside commode, these items will be obtained for you while you are in the hospital and then sent home with you. Should you go to a rehab setting, the rehab will obtain items prior to your dismissal to home setting. Equipment needed after a knee replacement is a rolling walker. A rolling walker and a 3-in-1 bedside commode to place over the toilet at home is needed for your traditional total hip replacement patient. Direct anterior approach patients need a rolling walker and may want a 3-in-1 bedside commode for comfort. Shoulder replacement patients only need a shoulder sling, which will be placed on your shoulder after surgery. Following dismissal from the hospital, call your physician if you have a fever greater than 101 degrees Fahrenheit, if your incision is red, hot to the touch, excessive drainage, foul-smelling odor, or pain not relieved with your medication. You will need to eat well-balanced meals. You will need to eat 250 extra calories per day as your body is working overtime to heal itself. Try to drink 6 to 8 glasses of water a day unless you have a heart or kidney problem. Get up and get moving. Add fiber to your diet by eating fruit, vegetables, and whole grain food items to avoid constipation after surgery. Most all patients go home or to rehab by car. Your physician would like for you to refrain from being intimate for 4 to 6 weeks to allow your joint replacement to heal properly. Our Orthopedic Prayer. Dear Lord, grant me patience, but hurry up. Our Journey. Tips for your recovery. Don't get frustrated with yourself. Pace yourself with therapy. Don't overdo at home. No household chores. Let family and caregiver pamper you. Take a nap daily. exercise, eat nutritional, well-balanced meals, add 250 calories a day, add fiber to your diet, drink 6 to 8 glasses of water per day. Sleeping habits and appetite can change, but will return during the recovery time. Please access the videos of the physical therapist at www.universityhealth.org. Please call me for any questions you may have following watching the video. You may reach me at 706-774-2760. Thank you for allowing University Healthcare System to provide care for you to get you back in the game of life.